Docteur CHIENKU, nous sommes de retour. Ce problème technique, il faut toujours expecter les problèmes techniques, ça arrive. Comme on travaille tous de la maison là, et donc cela peut toujours arriver. Docteur CHIENKU, j'ai une question ici de Fiston Njolo qui me pose la question sur Facebook. Il dit « Merci d'être en direct. Moi j'ai une question pour le docteur. Ce vaccin nous concerne, nous, Africains, en quoi? Quand nous faisons l'évaluation sur le taux de mortalité, vous allez trouver que ce sont les Blancs qui meurent plus que durant cette pandémie. Donc ce vaccin devait se limiter là-bas, pas en Afrique. C'est Fiston qui nous suit depuis le CHIENKU. Qu'est-ce que vous dites à Fiston, docteur?
Oh, merci pour la question. En quoi ce vaccin nous concerne? Le monde devient de plus en plus global. Et les gens transitent d'un pays à l'autre, d'un continent à l'autre. Ça veut dire que quelqu'un peut venir de l'Europe et infecter une ville, ou bien quelqu'un peut aller de l'Afrique ou l'Europe et il soit infecté. Et nous devons aussi dire que l'évolution de ce virus n'est pas forcément statique. Ça veut dire que ça peut être grave en Chine aujourd'hui, et demain ça sera en Italie, et après-demain en France, et puis aux États-Unis. Nous ne contrôlons pas entièrement avec le du virus, alors nous devons être très méfiants.
Et être très méfiant, parle-nous un peu plus, c'est-à-dire?
Parce que nous n'avons pas encore étudié tous les contours du virus. Je peux m'aller plus loin. Récemment, hier encore en Angleterre, il y a un nouveau variant qui est arrivé, qui est 70 fois plus virulent que ce qu'on avait vu avant. Et l'Angleterre, subitement, est devenue total lockdown depuis hier. Et l'Europe a interdit les voyages en Angleterre. Je parle de hier. Ça veut dire que nous devons être très vigilants. Nous ne devons pas baisser les bras. Oui, l'Afrique est vraiment épargnée cette fois-ci, mais combien de temps, on ne sait pas encore.
Pour combien de temps, on ne sait pas encore. C'est ce qu'on avait dit aussi au début de cette pandémie, docteur. Au début, on disait en Afrique, on ne sait pas encore, mais jusque-là, on ne sait pas encore. C'est ça?
Oui, il faut toujours prendre les mesures barrières, les mesures de prévention et même au besoin le vaccin. Je dis que prévenir mieux que guérir, on disait ça quand on était enfant. Voici le moment de prévenir mieux que d'être guéri. Et pour le moment, nous n'avons pas encore vu des effets indésirables catastrophiques. Comme je dis, nous avons vu de petites choses là, mais personne de grave qui a été hospitalisé. Et je dis, nous sommes même au début. Et en général, le début est un peu, puisque tout le monde essaie pour la première fois. Il y a des petits bouts, mais rien de grave.
Rien de grave. Et donc, pour tous ceux-là qui sont en train de nous capter en Afrique, ici aux États-Unis, en Europe, sur l'accent prononcé maintenant, vous les rassurez que ce vaccin est safe, comme on dit?
Moi, quand je regarde le profil scientifique, la manière dont il a été le génie de la fabrication, il savait qu'il sera le vaccin le plus safe. Parce qu'on a utilisé que quelques gènes pour produire une protéine qui est sur les flèches du virus. Ça veut dire que le matériel utilisé est très limité par rapport à une bactérie. Ça veut dire qu'au fond, il peut s'avérer que c'est le plus safe. Mais c'est la science qui évolue, comme je vous disais. Arriver à ces vaccins, c'est une collaboration intense dans les diverses spécialités de la science. C'est formidable.
Et donc on peut dire, docteur, ici que ce vaccin restera gravé dans l'histoire de la médecine dans le monde.
Oui, c'est là parce que ce vaccin entre dans ce qu'on appelle le gene therapy. Ça veut dire que quoi? Ça veut dire qu'utiliser les gènes pour soigner les maladies. Je vous prends l'exemple d'une maladie qui est au phare, dont on regarde à l'horizon, c'est la drépanocytose. La drépanocytose qui est une petite erreur génétique. Avec cette nouvelle technologie, on peut soit substituer le gène qui est défectueux ou on peut l'annuler,
Ouais.
ou on peut tout simplement rapporter notre gène. Ça veut dire que toutes les maladies génétiques qui sont des erreurs peuvent être corrigées.
Ouais.
Je vous dis que ça nous excite comme médecins parce que nous sommes en train de toucher des nouvelles frontières. C'est comme l'arrivée de l'Internet, c'est comme l'arrivée du téléphone cellulaire. C'est des grandes inventions. Nous sommes vraiment petits.
Ouais. Et je le sens même hein, quand vous le dites ça, je comprends parfaitement. Docteur, une question un peu, je dirais, un peu personnelle. Avez-vous déjà été vacciné vous-même?
Je voulais être le premier sur la ligne, mais on n'est pas encore arrivé sur moi. Mais je serai le premier et je le ferai live. Pourquoi est-ce que je veux le faire live?
Ouais, pourquoi?
Je veux dire que je ne prêche pas. Je vais à l'action parce que je suis sûr du produit. Je suis un médecin qui reçoit à peu près 60 malades par jour. J'ai fait les tests de Covid dans ma clinique. Ça veut dire que je suis très exposé. Je dois être protégé. Et je crois que ce vaccin a des bases scientifiques solides et je veux être le premier sur la ligne de fin.
Vous serez le premier en ligne pour prendre. Et vous avez bien sûr des infirmiers, des infirmières. Est-ce obligatoire pour vos employés, les infirmiers et les infirmières, de prendre ce vaccin?
Je ne sais pas comment vous répondre, mais je vous dirais ceci. L'Amérique s'appelle le pays de la liberté. Les gens sont libres de leurs choix et des conséquences de leurs choix. Mais je te dis, pour protéger les patients, parce que quand des gens viennent ici, c'est pour que leur santé soit meilleure. Alors je vais préconiser que tout le monde autour de moi soit vacciné pour qu'on ait ce qu'on appelle l'immunité communautaire. Ça veut dire que si nous avons 5 employés qui sont vaccinés, nous 5 nous sommes protégés. Et ça veut dire qu'on protège aussi ceux qui viennent vers nous, soit pour le vaccin, soit pour d'autres choses. Nous ne vont pas être la source de la maladie. Alors, les patients, ma famille, mes amis, je vais demander à eux tous de venir se faire vacciner. J'ai même demandé d'être un distributeur de vaccins. J'y crois tellement que je veux être aussi parmi ceux qui vaccinent la population.
Waouh, ça fait du bien de rencontrer un docteur qui nous donne tous cet espoir-là. Et pour ceux-là qui ne nous avaient peut-être pas capté en première partie, donc vous confirmez que cette histoire de cette vidéo qu'on a vu une infirmière tomber évanouie, c'est vrai, mais ça peut être pour plusieurs raisons.
Je réponds à ça de deux manières. La première manière que je dis, c'est qu'il y a eu ce jour-là 10 000 personnes vaccinées et à peu près 10 ont eu des effets indésirables mineurs. De deux, en général, quand il faut que ce soit une réaction allergique, il faut un peu plus de temps. Il faut que le produit entre dans toi et circule. Celui-là a été immédiat. Ça veut dire très probablement que c'est l'effet de l'émotion plus que l'effet du médicament.
Et vous avez très bien expliqué ce vaccin, les deux vaccins en fait, les deux injections. Et comme vous l'avez si bien dit, dans tous les cas, il y a toujours des cas qui vont tomber, mais très minimes, il y a toujours un petit pourcentage. Et quand vous nous parlez par exemple de 99 ou 95% de chances, et donc c'est un pourcentage un peu minime qui ne compte pas. Mais donc on peut toujours s'attendre à des effets secondaires pour certains.
Il y aura des effets secondaires, mineurs pour la plupart, mais pour quelques-uns qui seront allergiques à certains composants de la vaccin, ça peut être majeur, ça peut même aller à la fatalité. Mais on dit que ce vaccin, la première dose te donne une immunité à 90%, la deuxième dose à 99%. Ça veut dire que ça va réduire le nombre de décès à peu près de 90%. Nous disons que quand la médecine est là pour le bien du public, si on réduit le taux de fatalité et de fatalité de 90-95%, et que pendant qu'on fasse cela, on fait 1 ou 2 personnes, je crois que oui, on pleure la vie humaine, mais on a sauvé beaucoup plus. Il y a des petits risques dans toute chose qu'on fait.
Des petits risques dans toute chose qu'on fait. Docteur, c'est la période des fêtes, hein? Bonne année, Noël et tout ça. Qu'est-ce que vous conseillez aux gens à propos de cette pandémie durant cette période? Est-ce qu'il y a-t-il plus de chances que les gens puissent attraper cette maladie durant cette période de fête?
Oui. Oui, parce que nous sommes en général, c'est la période de gaieté, c'est la joie, c'est le moment de rencontrer les familles, c'est le moment où les familles viennent ensemble pour prier parce qu'ils ont pu atteindre la fin d'année, pour manger ensemble, pour célébrer l'année et tout. Et tous ces rassemblements sont des facteurs à risque de propagation des maladies. Surtout si on a des vieillards, des gens âgés, ça augmente les risques. Mais nous disons qu'il faut être très prudent. Il faut toujours garder le masque. Le vaccin n'empêche pas les mesures barrières. Les mesures barrières doivent continuer pour à peu près 12 mois. Mais petit à petit, nous allons faire reculer au fur et à mesure que l'immunité augmente dans la population. On va faire reculer les mesures barrières. Mais pour le moment, la vie est très précieuse. Il ne faut pas la gâcher à cause d'une fête de fin d'année, à cause d'une célébration. Elle est trop précieuse. Nous devons tout faire pour la préserver. Contrairement à ce que certains disent, la première règle en médecine, c'est de ne pas faire du mal. Un groupe de médecins ne pourra jamais prendre une réunion ou une conférence pour calculer comment faire du mal à la population. Ça n'arrivera jamais. Ça ne peut pas. Quand quelqu'un veut être médecin, son premier objectif, c'est de faire du bien pour le bonheur de l'humanité. Alors, les médecins ne pourront jamais accepter qu'on mette un vaccin sur le marché qui va tuer les gens, qui vont les paralyser, qui vont les rendre malades. Ce n'est pas ce que nous sommes venus en médecine.
Donc ce n'est pas un certain complot que le monde est en train de faire pour éliminer des personnes en masse.
Non, pas du tout. Et je vous dirais que oui, 2020 a été très difficile.
Mais vraiment, ça en est.
Mais comme la période de la naissance du sauveur du monde arrive le 25, il paraît que les bonnes choses arrivent. Parce que je vous dirais que la science est en train d'amener des choses formidables. Le premier, c'est ce vaccin qui a été fait en moins d'un an. En moins d'un an, on a pu produire un vaccin qui est efficace et des effets indésirables très minimes. En général, ça prend entre 10 et 15 ans. Vous comprenez la vitesse à laquelle nous sommes arrivés. La deuxième chose, c'est que il y a des gens qui sont en train de faire des études profondes pour prolonger la vie. Il y a des groupes qui ont déjà trouvé des projets très prometteurs de pouvoir prolonger la vie d'un homme à plus de 110, 120, 130, 150 ans. Ce projet est en place déjà. Et Google est devenu un engin de recherche médicale et ils sont en train de faire des résultats formidables. Vous allez entendre dans moins de 12 mois comment Google va faire prolonger la vie humaine de plus de 20 à 30 ans.
Waouh! Et ça, sûrement, on va essayer de vous avoir ici pour continuer à en parler. Ça, c'est un autre sujet très très fort. Docteur CHIENKU, je rappelle que vous êtes docteur ici en Virginie, médecine interne, c'est ça? Internal medicine, c'est ça?
Yes, Healing Hands Medical Center in Vienna, Virginia. Et je suis aussi le directeur médical du haut comité de la diaspora camerounaise, du haut conseil de la diaspora camerounaise.
Ici aux États-Unis, c'est ça?
Ici aux États-Unis.
Ici aux États-Unis, ça nous fait tellement plaisir. Merci docteur, restez avec nous parce qu'il y a aussi des amis anglophones quand même qui nous écoutent en ce moment. Donc on va essayer de switcher un peu en anglais pour qu'eux aussi puissent comprendre. So doctor, I want to welcome you again and I'm so happy to have you and to discuss this COVID-19 vaccine. That's the news of the moment, and we know that here in the US, as the second vaccine against the novel coronavirus is being called out across the United States ahead for the Christmas. We know this is the weirdest thing. I'm gonna start kind of like backward. Great Britain, as you were telling us in the French part, is shutting down you know, because of the concern of the new mutation, right? What is it exactly?
Your question is concerning what, the coronavirus?
Yeah, the coronavirus in Great Britain, in the new one. Yeah, the new mutation.
We have, for the last 24 hours, they just had a new variant of the virus, which is 70 times more potent and more infective than what they had before. This is
which is, if I understand more, which is highly contagious, correct?
Highly contagious and very potent.
And so, I guess before we keep on going, I just need to understand, what's the difference between that coronavirus than the coronavirus we have now?
Well, this is a mutation of what we have. Okay. Unfortunately, instead of being less strong, it's a more potent and more infective virus that came. So this is more dangerous. This is going to cause more morbidity, that is sickness and mortality, death.
And does the new vaccine that we have right now will apply to the same the same?
Probably yes, because what happened with the coronavirus that we have today, there is 29 specific proteins in the coronavirus, and we are targeting the proteins that are on the spikes of the coronavirus. So the same proteins are on that virus. With the vaccine, we think we'll be able to control that.
So I guess, Doctor, you have kind of like a general numbers of cases in the world. So we are reaching millions, I'll say, around the world. So with the new vaccine that's being already distributed here in the United States and in Europe, what can you tell us about the vaccine, since there's so many doubt and talk around this vaccine?
The vaccine is a breakthrough in science. Vaccines, the history of vaccines starts in 1796 with Edward Jenner, who injected the cowpox for a little 8-year-old girl.
Right.
And after the girl was inoculated, she was exposed to cowpox and she didn't get sick. That was the beginning of vaccines. In general, we have 3 groups of vaccines. The first group is called live viruses. It means we take the virus, we make it less strength, we attenuate its strength, and then give it to human beings. This virus is weak, so it cannot cause a disease in a immunocompetent host. However, it can trigger an immunologic reaction. First, the innate immune response, and second, the adaptive immune response. The second group of virus is called inactivated virus. The virus is killed. They are dead, so they cannot produce any disease at all. However, they have antigenic properties. They can stimulate an immune response. However, this immune response is very short-lived and is weak. Now we have what they call subunit vaccines. A subunit vaccine means they take just one little particle of the virus or bacteria. It can be the capsule, it can be just polysaccharides, it could be proteins. An example is the pneumococcal vaccine, where they use polysaccharide on the surface of the vaccine, of the virus, to produce a vaccine. The advantage of these kinds of vaccine is that they have less allergic reactions, they have less adverse reaction. Still on the subunit vaccines, we now have what they call nucleic acid vaccines, DNA and RNA. This is where the coronavirus vaccines come. We have 2 main coronavirus vaccines. The first is by Pfizer and the second one is by Moderna. Both of them are messenger RNA vaccines. What does that mean? It means we take the genes that we want to insert into the cell, we attach it on an mRNA, which is a single-stranded nucleic acid. We put it into a nanoparticle. The particle comes in contact with a cell, fuses with the cells, and releases its material into the cell. This material migrates to the ribosome, attaches to the ribosomes, and produces proteins. These proteins are specific to the coronavirus. These are proteins that are on the spikes of the coronavirus. When the body sees those proteins, the body thinks that you have been infected with the coronavirus, and then the body triggers the immune response. First, the innate immune response, and second, the adaptive immune response. What is important here is the adaptive immune response, because it has what we call T cells and B cells. These are memory cells. They look at the enemy, they identify the enemy, and they put him in a register so that when they come back next time, all the artilleries are out to shoot on the enemy. So this coronavirus is a vaccine, is an RNA vaccine, which tricks the body to believe that the body has been infected by a virus and send out soldiers to destroy that virus.
And doctor, so I guess this is, as you say, a breakthrough.
This is a big scientific breakthrough with collaboration of molecular biology, gene therapy, and medicine. It's a wonderful outcome.
Right. So, doctor, this new injection, as we just heard you talking, it's a hope for an end for this deadly, right, pandemic.
Yes, we think when we will be able to get a lot of people vaccinated,
Right.
we're going to develop what they call herd immunity.
Right.
Herd immunity means the population together have a certain level of protection. This is about 85%. Once we hit 85%, we talk about herd immunity. We'll contain the virus and we can push it back until we eradicate it. It has happened with certain diseases. Smallpox was eradicated by that way. So we think with the collaboration of the population, we can achieve a high level of immunity and push back on this virus.
So we know that the U.S. is already getting it, as I was saying at the beginning, distributed all over, different states. The question is, when, and I keep getting this question, when does African countries will start getting the vaccine delivered?
Well,
do we have an idea? I mean, roughly.
Yes, I think what we want to do with these vaccines is first target the most vulnerable population. And the most vulnerable population at this time is in the West. The most vulnerable population is old people. Most vulnerable population, people with chronic diseases. Those are the first targets. And it just started in the US, and those are the people who got the first shot. After that, first responders, doctors, nurses, and healthcare workers. So we'll go down the list. Concerning this virus, Africa has been lucky. And I think we've been lucky because we have some good traditional medicine, and we also have high temperature and sunlight. Sunlight has served to neutralize a lot of bacteria and viruses in such a way that the prevalence of this disease is very low in Africa. I think rightly, Africa can wait for its turn to have the vaccine. For now, we are targeting areas with high levels of infection.
And doctor, we know that here in the U.S. has surpasses 300,000, if not more, cases, COVID death, I should say. I'm sorry. Question that I'm still getting: how do you explain that compared to African cases, for instance? Why is the U.S. getting more than other continents?
Well, the rate right now of death in the U.S. is about 3,000 a day. They lost 3,000, approximately 3,000 a day. And this recrudescence of the coronavirus death and morbidity and mortality, two main reasons. The first reason is fatigue. Some people have gotten what is called COVID fatigue. They have been doing this for 6 to 9 months, and they're starting to get used to not doing it anymore. They're tired. The second reason is the cold. The cold weather is a big factor. Whenever the weather goes cold, viruses explode. And I was saying Africa has sunlight in abundance, which kills those viruses. And the temperature is also high in Africa. So these two factors have made Africa a charming continent for the last 9 months.
And that in a way has been helping Africa, the weather, I guess.
Africa has come out very well. We have fared very well. And even some countries have been congratulated by the World Health Organization for having done well with the coronavirus initiative. So for once, Africa is a shining light on the hill.
Right. Now, talking about Africa, I know countries like Morocco is gearing up for an ambitious COVID-19 vaccination program aiming to vaccinate 80% of its adults in an operation starting this month that's relying initially on a Chinese vaccine that has not yet completed advanced trial to prove it is safe and effective. The first injection could come within days, a health ministry official told the Associated Press, facing a public, skeptical about the vaccine safety and effectiveness, medical experts and health officials. So clearly, I guess we do have vaccine coming from all over, coming from Europe, coming from here, coming from China. What would people, how do you guys as doctors, professionals, what do you tell people? What would you tell Moroccans if they're expecting to use the Chinese vaccine? Should they go ahead and use it? Or what should you advise them?
Well, I would have hoped that Africa, since we are not that much heat, would have taken a cautious approach to this vaccine. Number one, I would have preferred that this vaccine gets associated with what they call expanded program on vaccination.
Right.
I would let some of our viewers know that before the coming of vaccines, life expectancy was about 50 years. Since the onset of vaccines, life expectancy has increased to about 72, 73 years just because of vaccine. And certain diseases have been either eradicated or very, very rare. I'll talk about smallpox is gone, chickenpox is rare, varicella is rare, poliomyelitis, I don't know if one has seen polio in the last, pertussis. So the expanded program on vaccination has been a total success in Africa. Growing up as a kid, I remember how many times people had measles, mumps, rubella, varicella. It's almost impossible to find any case these days. So we can tell people, we've done this in the past. We have a track record. You yourself have been vaccinated. You remember those days standing in line in schools and the health worker would shoot on everybody's elbow or shoulder.
Right.
So we have a proven record of vaccines being effective, safe, and making life better for the population. This one is even more efficacious and safe.
So, and you just go into the question I was going to ask. Talking about the efficacy of this vaccine, what percentage are we on? What
first shot?
The
first shot gives you 90%.
Right? There's two shots.
Yeah, 2 shots.
Yeah.
Generally, they want 21 days apart, but it can be 17 to 21 days. First shot gives you 90%. Second shot, you are between 95 and 99%.
Can we understand, Doctor? Can you explain to us why 2 vaccines? What explains that? Why?
Well, the reason why we're having 2 vaccines because of the live viruses is that when we started vaccinating people with live vaccines, the measles, mumps, and rubella, it was thought to be lifelong immunity. However, recent studies have shown that some people, not everybody, some people fade after 10, 15, 20 years. The immunity is not still as high as it used to be. That's why now we're having a second shot. Even on those vaccines that used to be said to be lifelong, we're having a second shot now. So there's people are taking the varicella shot again, measles shots again, because recent studies have shown that there's fading immunity, not for everybody, but for some people. And because the objective is herd immunity, everybody being immunized, we're giving second shots.
That's what it is. Okay. So I guess another question that I keep on getting, and I got this question from my friend in Zambia and Ghana who listen to my shows every Wednesday. They wanted to know, now that the vaccine is being administered and given in different places around the world, should people continue respecting or obeying those, all the distance, the washing your hands and using all those, chemical we're using? But should people continue wearing their mask and all those kind of things?
Yes, we're going to still recommend that for at least 6 months to 1 year. Social distances, washing your hands, wearing masks, staying out of crowd, avoiding crowded places, going to clubs, things like that. Because it takes time for the immunity of the population to reach a herd immunity which could be safe. It's going to take at least 6 months to a year. As many more people get vaccinated, we're going to increase progressively the immunity in the population, and we can start pushing back on some of these measures. But for now, all those measures are still in place.
And we were talking about different companies. You were talking about it at the beginning, Pfizer, Moderna.
Moderna, yeah.
Another question that I had, are these vaccines coming from these two places, are they the same vaccine? Are they different?
Essentially, these two are almost identical. They work through the same mechanism: DNA, RNA, protein production. It's just 3 steps: DNA to RNA to protein production. That's the whole summary of those vaccines. They're almost identical, these 2 vaccines.
Now, and I know you explained this to us, but a question that I had earlier, someone who wanted to find out, does this vaccine, somehow changes your DNA, messes up your DNA in a way?
No, this vaccine doesn't change your genetic composition. What happens is that when this nanoparticle blinds with your cell, it moves to the ribosome where the protein is synthesized. This protein is a protein similar to the coronavirus spike protein. Once that spike protein is produced, the inscriptions is made in such a way that the macrophage, which is the main destroyer of cells, comes and destroys that cells immediately. That is the end of that process. Now your body just goes on auto gear. So no, we're not going to change the genetic makeup of people.
People at all. All right. Doctor, you haven't got a vaccine yet.
I am looking forward to the vaccine. I am the #1 on the line. I want the vaccine not
because
only for me.
You guys are medical professionals, so definitely you'll be going.
It's going to trigger down. It's going to trigger down. But I want one for me. I want one for my staff. I want one for my family and everybody around me. Like I said, you need everybody around you to have immunity so that you can be safe. And I have a practice. I have people coming to see me because they are sick or because they want advice. I don't want to make them sick, so I need to protect myself and protect them. It is a safe vaccine. I can't wait to have it.
So you're not worried at all?
I have none. It's the safest vaccine yet to be produced because it's produced out of a little sequence of genes, very limited. So, as contrary to the pertussis or let's say a measles vaccine. A measles vaccine is made out of a whole virus, which is made out of thousands and thousands of particles. This one is made out of one little particle gene. So the side effects are less.
Are your staff worried about getting that vaccine?
No, not at all. My #1 job as a physician is education. I have to educate myself so I can educate my staff and so I can educate my patients. And I tell my staff and patients, faced with a deadly virus,
right,
and no therapeutic regimen that has been proven to be efficacious, your best bet is a vaccine that will protect you. And it has been shown that it protects 90 to 95% or 98%. I think it's a safe bet.
Wow. So, Doctor, those who are listening to us tonight in Africa, for instance, what would you tell them? Those who still had doubt about this vaccine.
I would tell them that this is a very efficient vaccine and it's very safe. and that we as doctors come into this profession because we want to prolong and preserve human life. We don't participate in any dubious thing to destroy someone's health or someone's life. That is not why we come to medicine. And there's no group of doctors who are going to sit together and plan this destruction of human beings. That is not going to happen, not in this lifetime. So, in the absence of a very effective medication, the only insurance policy you have is to get the vaccine. I would advise you to get it for yourself, get it for your children and members of your family, and everybody who works around you should get the vaccine. So together, you guys are all safe.
And if for any reason, doctor, there is an effect or there's a reaction from that vaccine, what should someone do?
Now, there are generally, most reactions to most vaccine is just local, a little bit of redness, a little bit of pain. A few people will have, headaches, problems with vision, muscle cramps, things like that. Right. But severe reactions are very rare. But if you start being uncomfortable after the shot, you need to go to the hospital. Someone has to see you and observe you and make sure you are safe. But as we're rolling out a new vaccine, we expect a few hiccups. A few people have some reactions. Some might be mild, others moderate, others severe. And we're going to make sure we try to make them safe and well. However, I am sure we're going to lose a few people. That is the nature of life. We are trying to save 99% of the population, but a few would have reactions to various components of the vaccine. It might not just be the gene, it might be the diluent, it might be the liquid in which they use to put the vaccine in you. Some component in there can react with someone who is allergic to that component. So we expect a few reactions, but out of the more than 10,000 who got vaccinated, we had less than 10 cases all over the US. So we think it's one of the safest vaccines out there.
Mm-hmm. Do we have, doctors, probably my last question, do we know when this vaccine will be also, I know, South Africa was already getting some, but do we know when other countries also will be getting this vaccine?
Like I said, the production of the vaccine is very, very costly. And this vaccine, the rollout and the distribution has to be done by the state. Okay. Because of its cost at this time. However, we have the World Health Organization, who already has an expanded program of vaccination. The World Health Organization can organize and include poor countries, less developed countries, to get this vaccine free. So I'm calling on them to start planning to roll out these vaccines to other places which otherwise will not be able to afford.
Dr. CHIENKU, I really want to thank you so much for the time that you've given us tonight. We'll try to call you during the week again if there's any development in this situation. But we really appreciate the time you've given us and our listeners who listen to us all over the world, who are very concerned about not only this pandemic, but also the vaccine that's coming to actually help save the world, if I should say so.
Thank you once more for inviting me. I hope I participated in enlightening the listeners about the efficacy and the side effects and the risk of this vaccine. I say it's very efficacious and the side effects are minimal. And I hope everyone runs fast to get one of these vaccines.
You have a good night, sir, and thank you for the time.
Thank you. It's my pleasure. Have a wonderful evening. Happy holidays.
Super. Same to you. Thank you.
Thank you.
All right.
Bye.
Haka said DJ Mirikona mawazo ya